I am Katrina Cole, the Executive Director of the Brian Grant Foundation. And this month, we're doing our webcast a little differently. Instead of Amy, you have me, Katrina, because we're going to be speaking about a very important topic, and that is the National Day of Action that's coming up on Tuesday, September 17th. And here to join us to talk about the National Day of Action is Amy Becker. Amy is currently the Director of Advocacy for the Michael J. Fox Foundation, where she focuses on recruiting, educating, and engaging the Parkinson's community so their voices can be heard. Amy holds 2 bachelor's degrees in political science and broadcast journalism from the University of Missouri in Columbia, as well as a master's in political science from American University. Amy joins us today from Washington, D.C. Welcome, Amy. It's nice to see you today.
Thank you so much, Katrina. So excited to be here and to talk about how we can all rabble arouse for good around Parkinson's policies.
Yeah, well, we are very excited that you're joining us today for a special webcast. Again, Amy Lavallee, who is our usual webcast host, will be coming back in October to speak with an expert about constipation and Parkinson's, which we know is a very important topic. But since the National Day of Action is coming up on Tuesday, we wanted to make sure we had a chance to hear from a policy expert from the Michael J. Fox Foundation about what that day is all about and what people can do to get involved. And so with that, Amy, I'm going to go ahead and turn it over to you. Amy is going to give us a presentation talking about the Day of Action and the policy priorities, and then we're going to open it up for questions. So if you have questions during Amy's presentation, please put them in the chat, and I'll make sure to get to them at the end when we do the Q&A. And with that, I'm going to go ahead and turn it over to Amy. Thank you.
Awesome. Thank you so much, Katrina. I appreciate it. And I'll also have some visual props here via a PowerPoint deck, because at the Michael J. Fox Foundation, it is not a presentation without a corresponding PowerPoint deck. So we'll have that on screen just to drive home some further points. But as Katrina noted, I'm Amy Becker. I'm the Advocacy Director for the Michael J. Fox Foundation. And I'm going to go over not just our upcoming National Day of Action, but different ways and policies at the federal and state level that we feel would really move the needle for the Parkinson's community, and how all of us can come together to unite our voices to, again, rabble rouse for good and improve the quality of life for Parkinson's patients and their families throughout the country. So with that, I do want to start out with the first slide. I'll wait for that to get up on the screen. And as that's happening, I do want to do a shout out to the Brian Grant Foundation and thank them for their partnership. They are a member of our United Parkinson's Advocacy Council, which is a coalition made up of over 30 different members from local, state, regional, and national organizations. Thank you so much. If you could go to slide 2, and I'll keep talking about the Advocacy Council, but they represent local, state, regional, and national Parkinson's organizations, where we coalesce around the mission to advance policies that support people with Parkinson's disease and their loved ones. And together we send joint letters to policymakers in support of relevant bills or federal rules. We also do constituent advocacy like the National Day of Action, and really focus on the foundation of our advocacy, which is storytelling, because when we're able to put a face to Parkinson's and show when you've met one person with Parkinson's, you've met one person. When you've met one family member, you've met one person, and everybody can come together with their community expertise. So we're so grateful for Katrina, Gavin, and the rest of the Brian Grant Foundation for being a part of that. So going on to the next slide of how we advocate as the Parkinson's community and why we advocate. Why am I taking time up on your call today to try and appeal to all of you to do one more thing? We're using the power of a diverse array of audiences in order to move those policies I mentioned that will really make a difference for the Parkinson's community. We're raising our collective voices of patients, family members, care partners, as well as providers and researchers alongside other supporters. That also includes elected officials, decision makers, and thought leaders, as well as corporate partners in order to move these policies. We kind of have this joke when we do Parkinson's advocacies that we call it 8 degrees of Parkinson's, where you may remember that 6 degrees of Kevin Bacon game from back in the early aughts. It always seems like whenever you talk to somebody, they have some connection to Parkinson's, whether it's themselves or an immediate family member or somebody close to them, someone in their immediate family or in their community. So there are ways that we can appeal to those audiences and bring them on board as an organizer. We engage in multitude of tactics, including organizing, relationship stewardship, as well as grassroots engagement and outreach. And through utilizing all of those different tactics and these diverse array of voices, we're able to net some very big results, including increased funding for Parkinson's research from our government entities, raising awareness around Parkinson's, building support for that research, getting advanced therapies and treatments, building up our champions who are going to fight for our community, and also leading us towards a cure and ultimately prevention. And going on to the next slide, this is one of my favorite slides out there. I can't take credit for it, unfortunately, but I just like to show it to further drive home a point that you all know. Passing laws is hard. Our founding fathers designed it to be that way. So not just any piece of legislation gets through. You know, we always are joking about how ineffective Congress is, but the process makes it that way. It's not supposed to be easy. And you can see all these different points along the way of what we need to do to get an idea through the process to become law. What that means for us as advocates are there many ways for us to engage. There are many points in the process for us to engage. But the important thing is that we are sharing our stories and that we have a seat at that table and that we're making sure they know what we care about and what the impact of their votes and what these policies is going to be. And we've been engaging in advocacy for many years, and we've notched some major wins that I want to go into before we talk about another way to advocate through our National Day of Action. So going to the next slide, I hope most of you have heard about, last slide, sorry, we went too far. There we go. I hope all of you have heard of the National Plan to End Parkinson's Act. I'll do like a virtual show of hands. The National Plan to End Parkinson's Act is a mouthful, but is also the first federal legislation aimed at better diagnosing, treating, preventing, and curing Parkinson's disease, as well as atypical Parkinsonisms, such as multiple system atrophy, progressive supranuclear palsy, and Parkinson's-related dementias. This bill was overwhelmingly passed by the House and passed on unanimous consent in the Senate this last summer, and it was signed into law by President Biden on July 2nd, 2024. At the Fox Foundation, we had over 700 advocates hold nearly 500 virtual meetings with their members of Congress urging support of the national plan. We also had over 30,000 people sign our National Plan to End Parkinson's Act petition. So there's a groundswell of advocacy support through this. A little bit more about this piece of legislation now that it's been signed into law. This is a no-cost bipartisan bill, which was modeled after the National Alzheimer's Project Act, commonly referred to as NAPA, which was signed into law in 2011. And that bill essentially funneled over $3.8 billion with a B, billion dollars into Alzheimer's research and awareness. And as you can see, they have multiple pills on the market going through the FDA approval process right now, and we wanted that for Parkinson's. So the National Plan to End Parkinson's Act will direct the U.S. Department of Health and Human Services to develop and maintain an integrated national plan, which will hereby be known as the National Parkinson's Project, to prevent and cure Parkinson's disease and ameliorate its symptoms and slow or stop its progression. As a part of the National Parkinson's Project, HHS is going to establish a federal advisory council to evaluate the implementation and outcomes of this project. It's also going to advise the Secretary of HHS on Parkinson's related issues and provide additional recommendations for preventing, diagnosing, treating, and curing Parkinson's. This advisory council will be comprised of members of different federal agencies, people living with Parkinson's, care partners, researchers, clinicians, and other experts. Every year, the council will provide a report to Congress and the Secretary of HHS that will contain evaluations of all federally funded programs related to Parkinson's. That report will also include recommendations to prevent and cure Parkinson's, improve health outcomes, limit exposures to environmental risk factors, and look at reducing the financial impact of the disease on patients and the federal government. And I know there may be some interest in the chat, or there may be questions about being involved in the advisory council or who gets to serve on it. Right now, the Secretary of HHS will develop and establish the project and the advisory council. The process of putting together that council is going to, of course, require input and planning support from various government agencies and other stakeholders. Michael J. Fox Foundation is included in those conversations, and we know that the implementation of this council is going to take several months. But while we're looking forward to supporting HHS as they select those experts from the Parkinson's community to serve on the council, it will ultimately be up to the secretary who will be appointed to fill those seats. But as I noted, we are in contact with HHS and the Biden administration right now to ensure that the Parkinson's Project is prioritized and established. If you are interested in the advisory council or learning more about it, you can reach out to us at policy@michaeljfox.org. I'll be sharing that email at the end of this presentation as well. But know that this will be a process as we put this together, and we're, of course, going to share further information, and Katrina will be sharing those updates with you as well as we come upon them. So really great things that show the power of our advocacy and what we can all accomplish. One big thing to brag to your friends about, if you did take action on the national plan, is you got a piece of legislation passed in the least productive Congress in history. That's my dinner party factoid. So you can feel proud that they don't care. They don't agree about a lot, but Congress agrees that Parkinson's needs attention. So with that, let's go on to the next slide and go on to some more exciting things for the Parkinson's community. So this is another piece of awesome policy news. One of our main champions, Congresswoman Jennifer Wexton, a Democrat from Virginia. You may all know of her. She was diagnosed with Parkinson's on steroids, as she calls it, and is having to retire early from Congress. She has been a pivotal and dedicated champion for issues that are impacting not only the Parkinson's community, but the neurodegenerative disease community, I feel. And her, alongside her fellow, she was the lead sponsor on the national plan. Her fellow lead sponsor, Gus Bilirakis, a Republican from Florida, have introduced another piece of legislation that is looking to identify causation of neurodegenerative diseases and research that. They introduced the Harmonizing Environmental Analyses and Launching Therapeutic Hubs to Yield Bolstered Research and Innovation in Neurological Sciences Act. I laugh because in DC, we love an acronym. So we just lovingly refer to this as the Healthy Brains Act. And I could not, on second reading, tell you what each of those letters stands for. I had to write it all down and read it, as you saw. This has been introduced in the House. It has yet to be introduced in the Senate. We're still looking for a Republican co-sponsor, so stay tuned for that, but it has been introduced in the House. If passed, this piece of legislation would create a Centers of Excellence grant program within the NIH to investigate how environmental risk factors, such as exposure to harmful chemicals, contribute to the development of neurodegenerative diseases, including Parkinson's and atypical Parkinsonisms. It will provide, for the first time ever, a concerted and permanent federal effort to examine potential causes of neurodegenerative diseases. And it is going to be one of the policy focuses for our upcoming National Day of Action, which I will talk to in a little bit. And I know that Gavin is going to put in the chat further information about the Healthy Brains Act, so you can learn a little bit more about this bill and how we can take action to build further co-sponsors for this legislation so we can get it over the finish line. Going to the next slide to talk about another focus for our National Day of Action, and another policy priority for our community is environmental risk factors, specifically the EPA's proposed ban on the harmful herbicide paraquat. Back in April 2024, the EPA was reconsidering a proposed ban on the toxic herbicide paraquat. This chemical has been banned in more than 70 countries. The US is still one of the only ones who has not banned it. We know that extended paraquat exposure increases Parkinson's risk by 100 to 500%. It's also been linked to causing certain cancers as well. In the past couple of years, we have sent thousands of emails and calls to Congress from Parkinson's advocates, asking them to put forward a ban on this chemical. We also have met with the EPA and shared further stories and over 90 different studies that have linked this chemical to Parkinson's. But in true government fashion, they're reconsidering this ban. So they haven't completely banned it yet. So we are focusing on trying to push them to elicit to put forward this ban before the end of the year. They do have till mid-January 2025 to make a decision. But for our National Day of Action, we are going to be putting together a petition urging President Biden to ban paraquat and to have his EPA ban this. Some of you who are located in California may know that at the beginning of the legislative session, they had a piece of legislation that was looking to ban paraquat, making California the first state to do so. Unfortunately, but fortunately still, that legislation has been watered down to the state reconsidering the use of the chemical in this state because of the agricultural community. There is high instances of paraquat use in the state. So that piece of legislation, reconsidering paraquat, has passed the state assembly and is now currently waiting on Governor Newsom to sign it into law. So as a part of the National Day of Action, we will be having a special action for our California advocates out there to urge the governor to sign that legislation so they can further take action on paraquat. Moving on to the next slide and talking about state policy, that was like a little nudge, nudge, wink, wink to our state work. I know I've talked a lot about things happening in the federal level, but there is a lot happening in our state legislatures as well. The great thing about states, they have to balance a budget first and foremost, and they also move a lot faster than Congress does with passing legislation. And we've had a lot of successes in the past couple of years of passing state-related Parkinson's legislation. I just noted the bill in California, but we have some others that are focused on some priorities of ours. One is Parkinson's research registries. These are statewide population-based registries, very similar to cancer registries, that are rich data sources that can fuel research and help researchers, clinicians, and policymakers better understand Parkinson's and how to treat it. As of right now, 14 states have Parkinson's registries. We were just able to pass 3 in 2024. That's Connecticut, New York, and Virginia. And I know I can share some further resources to see if your state is one of them. Washington, unfortunately, is not one of them. California is one, though, if we have anybody in there from there. Another piece of legislation we focus on is coverage requirements for biomarker testing. And in 2024, we had 7 states pass legislation to expand coverage. That includes Colorado, Connecticut, Florida, Hawaii, Indiana, Iowa, and Maine. As of right now, 19 states ensure access to biomarker testing. 2 states also passed legislation to expand protections for genetic testing, Louisiana and Nebraska. And then we also had our first ever collaborative state funding legislation introduced in Pennsylvania. This is state funding. It's $10 million for innovative research that would benefit Parkinson's, ALS, and Alzheimer's. So that's something else that we're looking at in 2025. But I just wanted to put this here that there's more happening than just on Capitol Hill. You can look at your own state legislature for opportunities to advocate for these pieces of legislation that are really going to benefit our community and get that research support, get that further funding, and further raise awareness about Parkinson's. Okay, next slide. That was a long lead up to what Katrina actually invited me to speak about. But I'm here to actually talk about our National Day of Action that is occurring next Tuesday on September 17th. This is all virtual, so is accessible to everyone. All you need is time and an internet connection. And this is our opportunity to raise our collective voices nationwide in support of those critical policies. We're asking people to take digital action. I noted the 2 focuses that we'll have at the federal level, which is telling Biden to ban paraquat by signing that petition, and then also urging your House representative to co-sponsor the Healthy Brains Act. We're also reaching out to our state lawmakers, asking them to prioritize Parkinson's policies in 2025. This is a great time to reach out to your state lawmakers because they're starting to put together their priorities for the upcoming legislative session. We're also going to be asking advocates to share their stories and raise further awareness on their social media channels using the hashtag ACT, the number 4 PD. So hashtag ACT for PD. And like I said, the great thing about this is it's a choose your own adventure of how much or what you have time to do. But the thing that we want is everybody coming together on September 17th to take action and to educate our community and our decision makers of why they should support members of the Parkinson's community and what they can do to support our community. So there's going to be a link in the chat that will take you to a landing page that has all of those different ways that you can engage. But as I said before starting this out, the bedrock of our advocacy is storytelling. It's putting a face to Parkinson's and showing the different issues that we face, but also what's out there that we can do to respond and improve the quality of life. So definitely check out that landing page. It's also a great time to do not just our National Day of Action, but to further engage with your lawmakers. I'm not sure if anybody saw, but there's an election going on. November is right around the corner. And actually, your members of Congress are going to be back in district for the entire month of October to get in some last minute campaigning. So take action on September 17th with us, take that digital action, and then maybe have another bite at the apple in October and look to meet with your lawmakers in person when they're back in your community and educate them further about Parkinson's and what they can support, what legislation is out there that they can also support to move the needle for our community. And going on to the next slide of advocacy, even though we're talking about the National Day of Action as well as kind of getting out the vote when they're back in district, advocacy, again, as I said, is a choose your own adventure. It all depends on the time that you have. If you have 5 minutes, you can post your story. You can recruit other advocates because we're only as strong as the number of people we have. You can share an action alert. If you have a day, you can do relationship mapping. Were you roommates, college roommates with your current congressman? Let us know that because that can help you get a foot in the door and get another champion for the Parkinson's community. You can educate lawmakers and other people in your community about Parkinson's. You can write a letter to the editor in your newspaper to further educate your community about what's out there. If you have a week, you can write an op-ed. You can meet with the editorial board of your newspaper. You can present to your support group or do things like we're doing right now, talking about the different ways that you can advocate, the different policies that are out there so we can further move that needle. If you have months, you could potentially attend an in-person event. I know that the Grant Foundation has some amazing in-person things that they're doing, and we'll have some advocacy opportunities for you, or putting together fundraisers for Parkinson's research for different groups like the Grant Foundation, and inviting elected officials to also learn more. So again, it's really choose your own adventure based on what time you have. And do not worry, go to the next slide. We would not leave you high and dry with all of that. I just give you things to do and not help you inform how you can do them. The Fox Foundation does have an action center with a plethora of resources, as well as the action alerts that I just mentioned earlier in this call, as well as further information on those policies I mentioned. So like the National Parkinson's Project, you can learn more. But we have one-pagers about different policy priorities that the Fox Foundation has identified. We have tools and resources. We have an Advocacy 101 toolkit, an elevator pitch worksheet to help you get your story to a shortened amount because we all know we have very limited time with lawmakers and we want to make it count. We also have advocate training sessions. We have upcoming events, things like that. So I definitely recommend you check that out and we can share that link with you. But then finally, wrapping it up and going to the final slide before we open it up for any questions you may have, please consider myself as a resource. I'm putting our policy email up there. If you have any advocacy questions, please feel free to reach out to Katrina and Gavin because we do work very closely together and collaborate on ways that our community can respond and advocate for these different bits of legislation or awareness or identifying those opportunities that we can really make a difference. So again, consider all of us as a resource. And I just want to thank you all so much for sitting through this presentation and for always bringing the passion and dedication. This is how we pass the national plan. This is how we get further funding for Parkinson's research. It's because all of you and all of your passion. So thank you so much for being here. And Katrina, I'll turn it back over to you for any questions.
Thank you so much, Amy. If you have any questions for Amy, please go ahead and put them in the chat. Amy, I just want to ask really quickly, if you are signed up to receive Michael J. Fox Foundation emails, will you receive the action alerts?
You will. That is a
Okay.
great question. So if you sign up for our Parkinson's Policy Network, so many P's. But if you sign up for our Parkinson's Policy Network, you will receive urgent emails when your voice is most needed. We're not going to spam you. It's not going to be like the campaign emails I'm sure all of us are getting multiple times a day right now. We are going to reach out when your voice is urgently needed, either at Congress or in your state.
And you talked a little before about the intentional difficulty of passing a law and that piece of trying to get things through. And I appreciate you bringing that up because I think that's sometimes something we all forget in the frustration of the day-to-day news cycle about what's happening in politics. And yet you passed national plan. And that's very exciting. And so when you think about that day, the national plan or passing the national plan, what do you really think it took to get there?
I think it took advocate stories. That is the great thing about our movement is we have people who can share their experience and can share the myriad of experiences. We will have 3 advocates on a call, and each one of them, their stories change so different. And it's about also challenging those misconceptions. I mean, I did joke that about the 6 degrees of Parkinson's. So many times I'm talking to somebody on a plane or I'm talking to a member of Congress, and every single conversation is always, oh, my father had Parkinson's, my first grade teacher, I knew this person or this person. It is unfortunately so prevalent and something that can bring us together. But the way that we passed the national plan is that we led with advocates. We led with our community and put a face to this disease and showed why we need the national plan today, not next week, not next year. We need it now. And that's what really moved the needle. Like I said, 30,000 signatures and 30,000 people sharing their stories digitally, 500 people sharing their stories like this. We didn't let up. And that's what got that done.
And that's what gets it done. And so that's why it's so important to sign up, to get the action alerts from the Michael J. Fox Foundation, because your voice really does matter. That's what pushes a piece of legislation through an intentionally difficult process. And I think that's really fantastic. And so here we are with 2 very, very important policy priorities, also incredibly important to push through. We're looking at the environment. We're looking at the environmental factors linked to Parkinson's disease. Many of these chemicals have been on the market for decades. And there is a lot of resistance to getting them banned or at least limited in their uses in our community. And so again, we're asking advocates to join us on September 17th. One of the things we're asking the EPA to do, the EPA is in the process of reviewing the chemical paraquat. Can you tell us a little bit about what that review process looks like for a chemical once it's on the market?
I can definitely go through the advocacy realm of it and also how it opens up to rulemaking in the government. Usually, when the government is putting together a rule or review, it has to be opened up publicly for a certain amount of time so that all relevant stakeholders, anybody, can weigh in and provide opinions and expertise. So, when the EPA announced that they were opening up paraquat for review. They've also done that with Tricor Ethylene, TCE as well. When they opened that up, that meant that we could secure a meeting with the EPA and the staff who work on this with advocates. We had medical researchers, we had members of the medical community, clinicians, and also researchers, and they held a roundtable to learn more. Also, Katrina, I know you probably remember UPAC, the United Parkinson's Advocacy Council. We submitted a letter when that rulemaking became open, when that review became open, of we, the undersigned, want you to ban this. We also submitted over 90 pieces of research tying paraquat to Parkinson's that last we heard they're still reading, which, okay. But this opens it up so citizens as well as experts can weigh in. It also means that members of the chemical industry can weigh in and can say, this is why we don't want to ban this, or this is what we'll do instead. we saw that a little bit with California, how they're now looking at doing the task force basically and doing a review. It's kind of the same thing, except we have a little bit more wind in our sails in the California. So it's really opening it up to these different stakeholders so we can all weigh in, go on the record, because now it is on the record that we are all out there for banning this chemical. And like I said, the deadline for that is again mid-January. That's when the review will stop and they will stop taking any submissions or anything like that. So that's why we're looking at getting this petition in, continuing to share stories so we can remind them this deadline is nigh. Also, the Biden administration will be done mid-January as well. So it's something that we want them to get done ASAP.
And
TCE is being looked at. Sorry,
okay.
Katrina. I just saw the chat come in. TCE also is being looked at as well.
TCE is also being looked at. Paraquat banned in 70 countries. 90 pieces of research submitted to the EPA showing the link to Parkinson's disease. And we have a banparaquat.org website up now, partnership between the Michael J. Fox Foundation and the Environmental Working Group that has brought together really diverse coalitions. We have farm worker justice, earth justice, beyond pesticides, a number of different groups that are all involved in this. Can you talk a little bit about those strategic partnerships and how they came about?
Absolutely. And this also goes back to your first question about what got the national plan done. It was advocacy stories, but it was also collaboration. It was the coalition. And I think, I've worked in politics for over 15 years, and it's coalition building that really gets things done, especially strange bedfellow coalition building. So by having neurodisease groups like the Michael J. Fox Foundation, like Brian Grant, partnering with these environmental groups, we all bring our bit of expertise and our audiences. And it's even more powerful to have us all come together and say, this is why this needs to happen. Also, a part of that coalition is the farm workers, the United Farm Workers Union as well. Dolores Huerta, who is my hero, is lending her voice around that, because it not only we can talk from the disease aspect as well as the environment, but then we also have ag workers who are disproportionately impacted by this, people who are working in the ag industry. So they have a voice to this. And so for us to bring this diverse cacophony of people, of different groups, that's what really helps move this as well. So it's not just one group is saying this, you can say how it impacts everybody. And how that came about is a lot of this research of showing what paraquat, what these chemicals was tied to. So the environmental groups who were wanting this to be banned, they have a lot of lists of reasons, and one of them is the health impact. So of course, bringing in disease groups would make a lot of sense. Something that gets pushed back on the other side, what they're saying is that it'll cost a lot of money to get rid of this chemical. But then that's where we have the agricultural workers and also different farmers coming in and saying how they made the switch and everything like that. Again, it's all about storytelling and putting a face to this. We have the data, we add the 90 bits of research, but then now we have real people saying, this is how it impacted me, or this is how I changed. Like we have an organic farmer from California who always used to use different chemicals. He was diagnosed with Parkinson's, and he made the switch to organic farming because he felt that there was a connection there, and he's testified about that. So being able, we always talk about, we can yell stats till we're blue in the face, but when I can put a face to something that somebody can relate to, that's when we get things done. So having a coalition behind this is a way for us to do that, to diversify our message and all of that.
Yeah, and banparaquat.org, please go to banparaquat.org. There is a really moving video of a farmer speaking about his life using paraquat in his farming, and today he has Parkinson's disease. It's a really important video to watch. I think it's very moving. It's especially moving when you think about the people who are feeding us being sick because of the chemicals that are being used. And we talk a lot about paraquat. We talk a lot about TCE, trichloroethylene. That's one that we're very interested in because our founder grew up near Camp Lejeune. His father was stationed there. And so TCE is also high on our priority list. And that's just the beginning of what we're trying to learn about chemicals and environmental toxins and their link to Parkinson's, which can take decades to present itself. So here we have the Healthy Brains Act, which is also really important because that's going to give us a chance to actually really look more thoroughly into the links between chemicals and neurological conditions, environmental toxins in general. And
yes, absolutely. Sorry.
yeah, and in that one, we're talking about coalition building. We're also working with other neurological conditions to move that forward. Can you talk a little bit about that?
Yes, of course. We're working with a lot of people, especially in our United Parkinson's Advocacy Council, as you know, Katrina, with different groups like our Cure PSP, which is very involved with Congresswoman Wexton. And yeah, I do want to stress with the Healthy Brains Act, it's not only focused on Parkinson's. This is neurodegenerative diseases. We have had a lot of talk through different federal agencies of what they feel is just all of a sudden the rise in neurodegenerative diseases over the past couple of years. But Katrina, as you said, these can take a while to present themselves, but then we also know the miseducation and misdiagnoses and things like that. But I don't think a lot of people outside our community know how much we don't know.
Yeah.
About neurodegenerative diseases. My own father has Parkinsonisms, and until I started here, I didn't know that there was not an easy test for Parkinson's. It was just something we lived with, and I didn't even know. And this was something that impacted my family, right? And still, also in this community, there's certain subsets and other things that other diseases experience that we don't know about. So putting together that coalition, we can represent all of those different aspects that we may not have included. And especially when we're looking at the Healthy Brains Act, which is putting together the centers of excellence, there's a lot of different things that we need to make sure we're represented in unbiased and diverse research. As well. So having all those different groups, especially with UPAC, which is such a great coalition because so many people represent different things, just like Katrina talking about Brian Grant Foundation and what you all focus on and what your expertise is, it really helps to make sure that we have this diverse, this 30,000 foot view of our strategy and what we're making sure is included. That's also what made the national plan so successful, is that was a coalition effort as well. And we were making sure that everything was going to be like atypical Parkinson's was included in the national plan. We've had issues in the past of getting the government to include that in things because they think that Parkinson's is a catch-all, and we all know that it's not, right? So just having those different coalition partners, but I think also we all refuse to settle for the status quo. That's the thing that I love about this community. Everybody, as soon as we pass the national plan, I see George Ackerman on here. He's one of the ones that's like, what's next? What's next? And that's what every group is like, is what's next? What more can we do? And that's how the Healthy Brains Act Coalition really came about as well, that people saw what this could do and they were representing their communities. And so that's what's so great about Coalition and this entire movement, is that we're always looking for ways. We're never going to be satisfied until we have prevention and a cure, right?
I really appreciate what you're saying about how much we don't know. At the World Parkinson Congress last year, I had the pleasure of being in a session where they were talking about environmental links to Parkinson's, and they were talking about TCE. And one of the scientists on the panel was discussing how they were able to look at the biochemical pathway that TCE affects that could lead to the changes that lead to Parkinson's disease. And in that is information about the cause of the disease, right? And how important that is in order to understand the disease when you are looking for better treatments and a cure. So this is prevention, but it's also trying to understand the disease itself and the chemical pathways that can support research across the board. And I just thought that was super interesting because a lot of times when we talk about advocating on and the environmental pieces, we're thinking about prevention, but there's so much more to it.
Yeah, absolutely. And also when you're looking at causation, there is this spider web of everything else that impacts as well when you're looking at this causation of neurodegenerative diseases and what this is through the environment, through genetics, through that combination of identifying all of these things. So I think it's, again, why it's so important that we're sharing so many of these stories. I can't tell you how many advocates I've had in meetings that are like, well, I grew up on a farm, maybe that's it, or used aluminum, I don't know. And that's just so powerful, is uncertainty can bring us all together,
Yeah.
that fear of uncertainty. And it's just so powerful and further shows why we need this public-private partnership between us as citizens, us as members of the Parkinson's community, and our elected officials, our decision makers. When we come together, this is how we can really go farther and invest more into that research, because it's not just going to impact the Parkinson's community. This will impact other neurodegenerative diseases. This will impact other diseases out there. We all know that with like the identification of biomarkers, as you noted, there are reverberations for what we are doing. But further showing and telling these stories is further showing why we need that partnership between the public and private sectors.
Yeah, I want to say again, I just want to remind everybody, National Day of Action is this coming Tuesday. If you have not signed up for Michael J. Fox Foundation emails to get the action alerts, please do so. Please also go to banparaquat.org, where you can lend your name to the petition on September 17th. I think this is a really, really important issue. That's why we have Amy on today. Well, the other thing we talked about is UPAC, and I just want to say a lot, it's kind of the I don't know how to best to say, the unsung wonderful work of the Michael J. Fox Foundation and the rest of the organizations that are a part of it. We are constantly helping to sign on to letters that are things, everything from what we're talking about today, public comment on the Paraquat review, to making sure that Medicare will cover tests and imaging studies that people may need to get their treatments, to the national plan, to all kinds of things. And behind the scenes, there's a policy team at the Michael J. Fox Foundation that is helping to keep us on the pulse of what's happening and allow all of us to speak with one voice, so that Parkinson's is at the forefront of what our legislators are thinking about when they go in to pass these bills and look at these policies. So can you just tell us a little bit about the policy team at the Michael J. Fox Foundation?
Yeah, of course. And I'm going to say one thing before I get into our framework, because you set it up so perfectly. Is the great thing about organizations that make up UPAC are their community organizations. They're the boots on the ground. They're doing this grassroots, you may have heard me mention, but this grassroots engagement. And that's being experts on the community, knowing leaders in the community, and identifying those community engagement opportunities. That's where this is all happening. It's not getting a front page story on the New York Times that's going to do it anymore. It's being in the community, being a community leader, and talking to one another and identifying these opportunities. And that's the power of UPAC, that we have all of these community organizers and these community leaders who are coming together, representing their community and making sure that those voices are heard through there. So, okay. End of UPAC soapbox. So at the Fox Foundation, we have a policy team that is made up of three separate teams. We have the federal team, which is focused on engaging stakeholders in Congress on Capitol Hill, as well as relevant agencies and the current White administration who's in the White House. They are made up of 5 people as of right now, and they look at different policy priorities. That we have a tiered system of identified policies that we feel are going to do the most good, but then also have the most likelihood of moving. As you remember that difficult slide that I put up, you have to look at opportunities when you're doing this work, because sometimes it's just not in the cards. When you look at the makeup of Congress, their calendar, it may not be the year to do this piece of legislation, or the new chairperson of the Senate Help Committee is actually ran on a Medicare platform, and that provides that opportunity. So you always have to look at that, which priorities and policies you're going to go forward with. Besides the federal team, we have the state policy team, and it is a mighty team of 2. They are focused on state Parkinson's policies throughout the country. Of course, since there are only 2 people, we're not active in 50 states, but one day we will be. And I'm a little biased because I think I came from a state capital at the beginning of my career, so I'm biased. But state government is where it's at. Like I said, they move so much faster. There's so much opportunity, and there's so much opportunity for stewardship, for relationship building. for going to your state capitol and meeting with your state lawmaker and sharing your story. So they are focused on getting those major wins. And there is a want and opportunity there with state lawmakers to do more for the Parkinson's community. So we have that, the state team, and then we have the best team, which is advocacy, which is me, just me. So a very mighty, small but mighty team. And I really work to support the federal and state teams in their goals and in their campaigns by activating advocates when we need them most, highlighting advocates that would make the most sense for when we need policies moved. And that's anything from shooting emails out like we're doing with the co-sponsoring Healthy Brains, sending you all emails asking you to click a link to take action, putting together days like the National Day of Action, or we just got done with the summer recess campaign where we were asking advocates to meet in person with their members of Congress, or getting out the vote for Parkinson's to educate candidates and incumbents. So really, it's a way to get innovative and really help them move the ball down the field on these different priorities. And our policy team is nestled in the research team at the Fox Foundation, further showing just a commitment to our patient-centric approach of all of the different ways that we can serve the Parkinson's community and different ways we can advocate through funding research, through passing important policies, through increased funding and things like that, through identifying these different clinical trials. So that is our small but mighty policy team. Hopefully we'll be getting bigger, and a major part of the policy team is the 94,000 advocates we have as part of our Parkinson's Policy Network. George, again, I saw you. You are one of them. And none of this would be possible without them. Yeah. It would not be possible without our advocates clicking those links, sharing their stories, keeping our legislators honest, letting them know that we're not going to forget, that we're going to tell you our story, but we're not going to go off into the night. We're coming back to make sure that the Parkinson's community is watching, and we want them to take action and to support our community, right? So that is the bedrock of what we do, is those advocates, and all of this is possible because of them.
Yeah, I really appreciate you saying that, Amy. And I want to say that we really enjoy being a part of UPAC, because I do think that you see the work moving forward, you see the difference that it's making when you see a piece of legislation pass. It is very exciting. It's very great news. And again, the 94,000 advocates that are making that happen, we really appreciate them. We, again, are talking about the National Day of Action on Tuesday, September 17th. That's coming up. We are very excited to work with UPAC and the Michael J. Fox Foundation to get as many signatures on the petition to ban paraquat, to get as many signatures on the letter to legislators to pass the Healthy Brains Act. We are very excited to see these two issues move forward. And we are very grateful to you, Amy, for your one-man show that is helping to make all of that happen. We don't have any other questions from our chat. So Amy, I just want to say thank you so much. We will be in touch with everybody on Tuesday to make sure that you got your signatures in. I hope everyone has signed up for the action alerts of the Michael J. Fox Foundation. And Amy, thank you so much for joining us today. I really appreciate it. We will be back on the second Wednesday of October at noon Pacific time with Amy LaValle, who will be talking with an expert about constipation and Parkinson's, a very important topic. And we hope we will be able to report back to you on a very successful National Day of Action because of everyone who's getting involved. So with that, thank you so much, everyone. I'm looking forward to Tuesday. Take care.
Awesome. Thank you so much, Katrina. Have a good one.
You too.